ओम धम धन्वंतरे नमः। कर्पूरगौरं करुणावतारं संसारसारं भुजगेन्द्रहारं सदा वसन्तं हृदयारविन्दे भवं भवानीं सहितं नमामि. So today's topic is Poushkaradi Kashaya, its clinical indications. This Poushkaradi Kashaya usually used in the management of respiratory disorders. So Kashaya preparations are polyherbal formulations. They are having least adverse drug reactions if prescribed ideally. They give wonderful results. Patyadikada, Maharasnadikada, Mahamanjishtadikada, Triphala Kashaya, Maricha Kashaya, Shunti Kashaya, and Panchayita Kashaya are few Kashaya preparations which are commonly used in clinical practice. It is given in common respiratory disorders like upper respiratory tract infection, lower respiratory tract infection, Pratishaya, Penasa, acute bronchitis, chronic bronchitis, bronchial asthma, bronchiectasis, emphysema, carbonale, pneumonia, influenza, and pulmonary coughs with the suitable adjuvants. It is given with suitable adjuvants. In above said disorders, it shows desired results. It contains drugs like Pushkaramula, Shunti, Maricha, Kapitta, Barangi. They are having actions like Dipana, Pachana, Amapachana, appetizer, carminative, digestive, anti-infective, antibacterial, bactericidal, anti-allergic, bronchodilator, mucolytic, expectorant, and immunomodulator actions. The present paper highlights about the clinical indications of Poushkaradi Kashaya in experiential and scientific view. The Kashaya preparations are very easy to prepare and consumption. Poushkaradi Kashaya is Kaphavatahara in action and commonly given in upper and lower respiratory tract disorders. It is given in Kasa, Shwasa, Tamakashwasa, Hikka, Pratishaya, Penasa. It is also given in upper respiratory tract infection, lower respiratory infection, and rhinitis, deviated nasal septum, nasal polyps, acute bronchitis, chronic bronchitis, bronchial asthma, bronchiectasis, emphysema, carbonale, pneumonia, and fungal infection of the lungs. Pushkaramula, that is Barangi, Khatpala, Shunti, and Pippali, are Ushnaviri-yukta drugs and also having the actions like Dipana, Pachana, digestive, and appetizer also. It digests the ama and also detoxifies the toxins produced in the body. It has least dose drug reactions. The main objectives are to study the clinical indications of Poushkaradi Kashaya in experiential and scientific view. The material methods are relevant subject matters are compiled from the classical samhitas, Sangra Granthas, scientific journals, contemporary literature, internet, and personal clinical experience. The agents are Pushkaramula, Zinula resimosa, Katpala, Barangi, Clerodendron serratum, Vishwa, Gingiva officinalis, and Pepali, Piper longum. So this is the Pushkaramula. The mula is used, which is a bronchodilator and expectorant and mucolytic also. This is the Katpala, Verica sapida. So this is Ushnaviriyukta and Kapavatahara. This Barangi, Clerodendron serratum, it is Shwasahara drug. And Shunti, Ardhaka, Gingiva officinate, it is Ushnagunayukta, Katrasayukta, and Teskapavatahara and CNS stimulant also. And anti-allergic also. Pippali, Pipper longum, it is Rasayana and it is Ushnavirya and Katrasayukta and it is bioenhancer also. So bronchiectasis histopathology. You can see the dilatation of the bronchioles. This also bronchiectasis histopathology. That you can see the widening of the bronchioles because of pathology, isn't it? This is also bronchiectasis. You can see in the 1 o'clock position there is a bronchiole which is dilated. Right? This is the emphysema. There is dilatation of the alveolar sac. Again, very well see in the histopathology slides. So this is the emphysema X-ray. You can see the findings like increased intercostal space, increased translucency of the lung parenchyma, widening of the carina, and flattening of the hemidiaphragms and teardrop vertical heart. So the bronchiectasis, you can see changes. There is beehive-like appearance in the lung parenchyma. This is a chronic bronchial asthma. You can see the the hilar shadows are prominent, and bronchovascular markings are prominent in chronic bronchial asthma. And in deviated nasal septum, the CT scan shows the deviated nasal septum. Now let us see the actions of Poushkaradi Kashaya: antibacterial, bactericidal, anti-infective, Kapavatahara, immunomodulator, immunity booster, Kasahara, Shwasahara, Anurjatahara, anti-allergic, and bronchodilator, expectorant, mucolytic, anti-stress, adaptogenic, antioxidant, and Rasayan actions. Let us see the clinical indications. It is given in upper respiratory tract infection, lower respiratory tract infection, rhinitis, deviated nasal septum, nasal polyps, acute bronchitis, chronic bronchitis, pulmonary coughs, pneumonia with proper antibiotic coverage, bronchial asthma, bronchiectasis, emphysema, cor pulmonale, pulmonary edema, pratishyaya, venasa, kshavatu, influenza, and kapha jwara. Now let us see the micropraga. With suitable disease-specific adjuvant, it can be given in various disorders with the better outcome. Like in upper respiratory tract infection, it is given with Tribunakirti rasa and Sitapaladi churna. In lower respiratory tract infection, it is given with Mrityunjaya rasa and Mukkotukadi vati. In rhinitis, it is given with Nardiya Lakshmi Vilas rasa and Sitapaladi churna. In deviated nasal septum, it is given with Ranapari rasa, Mrityunjaya rasa and Lagusuta Shekaravati. However, there is no correction structurally, but symptoms will subside. Nasal polyps also symptoms will subside. It is given with the Shitamsh rasa, Raudra rasa, and Ananda Bhairava rasa. In acute bronchitis, it is given with the Tribunakirti rasa and Shitamsh rasa. In chronic bronchitis, it is given with the Kanakasava, Mrityunjaya rasa, and Talisapatra vatakam. In pulmonary coughs, with proper antitubercular treatment, it is given. And in pneumonia, with proper antibiotic coverage, it is given with the Tribunakirti rasa and a mixture of Purnachandroja rasa and Sitapaladi churna. So in bronchial asthma, it is given with Mrityunjaya rasa and Talisadi churna. In bronchiectasis, it is given with the Tribunakirti rasa, Somasava and mixture of Makaraja and Talisadi churna. In emphysema, similar medicine. In cor pulmonale, it is given with the Arjunalista, Prabhakaravati and Talisadi churna. In pulmonary edema, it is given with the Pranavadi Mandora, Sisabla churna and Kanakasava. So diuretic also given like Pranavadi Mandora. In Pratishyaya, it is given with the Nardiya Lakshmi Vilasa rasa. In Pinasa, similar medicine. In Kshabatu, it is given with Mrityunjaya rasa and Sitapaladi churna. In influenza, it is given with the Anandabhaira rasa and Lagusuta Shekara vati. In Kapaja jwara, it is given with Mrityunjaya rasa and Sitapaladi churna. Coming to discussion, Poushkaradi Kashaya has the ingredients which have actions like Tikta Kato Rasayukta, Ushna Guna, Ushnavirya, and Dipana Pachana actions. These ingredients are also having the actions like antibacterial, bactericidal, anti-infective, immunomodulator, expectorant, mucolytic, and Kavatahara actions. This is effective in Pratishyaya, Penasa, acute bronchitis, lower respiratory tract infection, upper respiratory tract infection, chronic bronchitis, bronchial asthma, bronchiectasis, emphysema, cor pulmonale, pulmonary edema, pneumonia, fungal infection of the lungs, and pulmonary coughs. So, however, it is given with suitable disease-specific adjuvant or add-on therapy. In pulmonary coughs, it is given with suitable anti-coughs treatment drugs. It can be given for prolonged period also. Some patients develop constipation after taking this formulation for prolonged period. It increases pitta dosha and pacifies kapha vata doshas. Coming to conclusion, Poushkaradi Kashaya is usually given in Kapavatahara diseases and respiratory disorders with good results. There is least adverse drug reactions even after administration of for prolonged period. It is usually given 50 ml dosage twice a day after the intake of food. So these are the references. Thank you for patient hearing.